Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on News Talk 1020 AM. Also find us on FM at 95.5. And you can find us online at foxnewskoan.com. That's foxnewskoan.com. You have questions today about your health, medical questions only, of course, or questions about our medical topics today, give us a call here at 522-1020. That's 522-1020. So reminders, as always, you'll find me at the Ellenburg Center for Natural Medicine during the week. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's drellenburg.com, or .net. Either one works. Check us out. I also see patients in Kenai and Palmer at certain times of the month, and give our office a call, of course, at 563-2366 for times. All right, well, old winter is still hanging in there, folks, so be careful out there driving around and walking in the snow. And it's slippery here and there, so take it easy wherever you're at. And just hopefully they will get a better summer out of this, maybe. Who knows? All right, let's get started today. We've got several topics to cover, and, of course, I'm always there to take your questions at 522-1020. We're going to talk today about two very interesting articles on melatonin. That's not just for sleep. We're going to talk about cancer as far as nutrition concerning those people who have cancer, and also we're talking about exercise and cancer outcomes, and talking today about the use of what's called prebiotics, an interesting term we don't hear very often. We're used to hearing the word probiotics. This is a prebiotic. And I was talking today about nitric oxide and its relations to metabolic syndrome, or early type 2 diabetes in a sense. And we'll end today with, if we get to it, talking about coffee and green tea, an interesting study out of Japan. Okay, well, we'll get started here. Again, in front of your station is 522-1020. So melatonin, well, it is made in your brain in what's called the pineal gland. And melatonin is secreted at night while you sleep. Typically, sometime it reaches its higher secretion times around 11 to kind of help you relax and kind of go to sleep. And then by the morning, light certainly affects it. And so people who are exposed to a lot of light, even in the nighttime, will not secrete a whole lot of melatonin. And we've had a discussion here several times, I think, here within the last couple of months, that is, of some articles that are looking at the links between night shift work and developing cancer. And we know there's been a couple of studies that have talked about that with breast cancer specifically. And what I'm thinking about last was colon cancer. But now we're hearing about a study that appeared in JAMA, which is the Journal of the American Medical Association, this April issue of this month, entitled Low Levels of Melatonin Up the Risk for Developing Type 2 Diabetes. In this study, they looked at women, and basically the kind of the overall picture was women secreting low levels of melatonin were more likely to develop type 2 than those who had higher levels of this hormone. And this is pretty much kind of a new finding. And people who actually had cases of diabetes in this group, this type 2 diabetes, they had lower levels of melatonin secretion than the control people in the study did as well. And the group they used was the Nurses' Health Study. It was started in 2000, and the researchers assessed participants in this group at baseline in that year, and used about 370 people for research for the research side of things, and then the other arm, of course, was controls. And they measured their melatonin levels via the urine, which you can do. You measure the breakdown components of urine, and there's 6 is a fun one here. They compared women in the highest category with 6 sulfatoxy-melatonin creatinine ratio. Yeah, so that's a fun one to say. Anyways, look for the breakdown components of melatonin in the urine and compared that with those in control groups. And what they found in those who had developed type 2 diabetes is that they had lower levels of melatonin. Now, we're not quite sure why this would actually happen. We know that melatonin receptors, and basically receptors kind of considered kind of a lock and key. So melatonin being the key in this case, floating around in your body and finding certain receptors the lock where it can fit into. We do know those melatonin receptors that are found throughout our bodies in many places, including the pancreatic islet cells. And so the pancreatic islet cells are part of your pancreas that secrete insulin, and typically are the areas that are damaged in people who have type 1 diabetes, where basically their body has attacked their pancreas and no longer able to produce insulin. So we have some animal studies too that suggest that melatonin may actually play a role in how we metabolize and use glucose. So very interesting in this case. Besides, we talked about in the past about articles linking low melatonin or night shift work to breast cancer and a few other cancers. We've also talked about melatonin being involved in affecting the immune system specifically. And as a naturopathic doctor, I myself do see a fair number of cancer patients, and we have a fair number of our cancer patients taking at night, not only for sleep if they need it or if they don't even need that, to kind of help stimulate their innate immune system. And it's one of the areas, in cancer where there aren't a whole lot of things that are already doing that. And, certainly, oncology, which of course I'm not an oncologist, but an oncologist are treating cancer with their known methods, which typically going to be surgery, going to be either radiation and or chemo, or both, or all three of those. And there's not a whole lot of focus, put on how can we, let's put it that way, strengthen a patient's immune system if they have cancer. And I think it's widely believed among a lot of providers that you can't even do that. Well, you can. And there's things that can demonstrate that with certain things, and melatonin is one of those. Now we see melatonin falling into this role of maybe some type of involvement with diabetes. And something for us to think about long term here is that if somebody is having sleep difficulties or has worked a lot of night shift work, and maybe you have some symptoms that would indicate you may have prediabetes, like you may have high blood pressure, you may have high cholesterol, you could be gaining weight. These are things, or your glucose levels are starting to rise up a little bit at a time. This could be a time not only to consider taking things like certain trace minerals that we use in our patients, such as chromium or even vanadium, but now even consider looking at melatonin. And we do know that in patients who have sleep apnea, they are at increased risk of developing cardiovascular disease and even type 2 diabetes because of disruption in the sleep cycle. Well, if you're not sleeping well at night, you may not be secreting the proper amounts of melatonin, and that may have an effect directly on your possibility of developing type 2 diabetes. So a very interesting article. Again, it's appeared in the Journal of the American Medical Association this month, looking at the final line here being that in women, low levels of melatonin is developing type 2 diabetes. And this is really a big deal because, we have, roughly, it changes yearly, unfortunately, in the wrong direction, it goes up. We have more and more men and women both, and children, being diagnosed with type 2 diabetes. And it's becoming somewhat of an epidemic, to say the least. And anything we can do to change that, the better. One comment here I wanted to make in here says, similarly, also in the study here, is that women who reported snoring on a regular basis were also 2.2 times more likely to develop diabetes than women who had never snored. So, again, may kind of point in possibly this kind of sleep apnea / sleep disruption into play here. So, again, really important how good night's rest you actually are getting. And by the way, on sleep apnea, if you suspect that, it would be very important to be assessed for it properly and find out if you definitely do have sleep apnea, because that can, again, increase your risk of type 2 diabetes, high blood pressure, and strokes. They have a lot of places now you can do at-home studies with the equipment. It's very minor equipment versus going to actual sleep center and doing one in-house. So consider that. Okay, well, if you're listening today, this is Dr. Michael Ellenburg. It's our medical show here on FoxNewsKOAN.com. You can find us. You can also find us at News Talk Course 1020 AM and on FM 95.5. If you've got questions about your health, here's a place to make the phone calls. Our number here again is 522-1020. That's 522-1020. Well, another article that appeared on melatonin, I did not get this last week because I ran out of time, but it was an article, actually it was a presentation that took place at the American Academies of Neurology 65th annual meeting. And talk again about melatonin possibly as a prevention of migraines. And those of you who out there suffer from migraines, it is a terrible thing. It can be extremely debilitating, and a lot of patients can be very, very hard to treat at times. And I've got some patients come in at times when I first see them as a patient, that is, and saying, "Hey, I'm getting migraines, a couple a month, and they're missing work or they're missing school or whatever part of how old they are, being a major disruption in their life." And so, any way we could figure out to try and help those people, the better. I do make a couple of comments about, of course, melatonin in a second, but also to remember about migraines, there's been some very good work, and I've even seen success in patients with using magnesium. I've seen success in treating people for hypothyroidism. If they have a low thyroid function, that can increase your chances of getting migraines. That can be related. And even years ago, we've used in many patients over the years, is having patients who get migraines supplementing with something called riboflavin, which is B2. And I'm not exactly sure on the mechanism of action on that one. In fact, I've never heard it quite explained very well, but it's been shown in some of the research in humans, at least, that riboflavin can be very good at preventing migraines from happening in the first place. And, of course, on top of this is having good rest, good diet, good exercise. There are many even food allergies that can cause migraines. So it can be a complicated picture, and certainly if you have a problem with migraines, it's worth looking in many different directions of ways of treating that, versus just taking something like Imitrex or some type of a heavy-duty medication when you have migraines. Frequently, let's try and figure out why you have them. And so in this case, this particular study, again, was presented at the American Academy of Neurology and was looking at people who were in this study were randomized to receive either amitriptyline, which can be used to help with sleep in a lot of patients and with migraines at night, and those who were taking 3 milligrams of melatonin at night. And 3 milligrams of melatonin is a decent dose. I mean, I can tell you in some of our supportive therapies for our cancer patients, some are taking even 20 milligrams a night. Depending on how I'm sleeping at times, I might even take 10 milligrams of melatonin myself a night for sleep. And in some people, even a milligram is all they need of the stuff. So it really varies. But if you've had use of melatonin over the years and did not find it helpful, a lot of times it could be because you didn't try enough. It could be part of the problem. And again, if you're not sleeping well, it's also good, for a long time, you're talking to your provider about what are possible things involved in that. It may not even have anything to do with melatonin at all. It may do other factors in your life taking place or in your health. But this study, again, looked at the use of a prescription drug, in this case amitriptyline, to 3 milligrams of melatonin. And overall, it was better tolerated than amitriptyline. There were lower rates of daytime sleepiness, which can be seen with amitriptyline. And you can see some of the daytime sleepiness initially in the early morning times once you're awake with melatonin, if you're taking a dose that's too much in what you need. And it really varies from patient to patient on that dose. But they saw good effects with that. And the biggest thing here in preventing migraines. And one of the presenters here with the study, named Dr. Perez, quoted that melatonin's role as also in regulating the circadian rhythm has been linked to other type of headaches, such as cluster headaches and even migraines, of course. And as we know that melatonin does play a very important role in how we sleep at night. If it's disrupted through just general insomnia due to stress in your life or a variety of problems or adrenal fatigue, sleep apnea can, of course, affect this already. We talked about it already. Or a delayed sleep phase, as they call it, meaning you're going a bit later at night or you're working night shift. All those things can affect that and increase chances of actually getting a headache in those patients who are suffering from cluster headaches and or migraines. The great part about the study also came out as well is that tryptamine for migraine prevention can frequently have increased weight gain while taking that sort of medication. And, of course, with melatonin, we don't see that problem. People aren't gaining weight taking melatonin. They do suggest at a certain time of night to take melatonin, which I typically haven't said because, people's schedules vary. I mean, if you're working at daytime hours, you might go to bed at 9, maybe 10, 11, maybe 12. And they're suggesting here that for taking melatonin, their recommendation is actually between 10 and 11 o'clock at night. Now, if you're staying up till midnight or something, you might want to take it, either go to bed sooner, which could be part of your problem, or take your melatonin a little bit later is what I would suggest. I usually try and tell patients to take it about a half hour prior to sleep. But, of course, melatonin in the study was tolerated very well and, again, compared extremely well to the treatment group that was receiving the amitriptyline. Yes, some people in the placebo group did get migraines or improvement, but it was way less than the improvement in the people taking melatonin versus those taking amitriptyline. So quite interesting for migraines. And again, you don't tend to think about with melatonin. And one thing to realize is that with all the hormones that have been discovered in the body, there's just a wealth of information we don't know about them and what their effects can be throughout the body in many ways. And here again, here's an example of melatonin. Who knows, being involved with migraines or being involved with type 2 diabetes risk. It's quite interesting. We got a caller on line 1. Sandra, are you there?
Yes, I am.
Hello.
Thank you for taking my call. On the migraine issue, I know someone who has what they call sparkle headaches, but literally puts them down, incapable of doing anything. And then when the sparkles leave, it turns into just a really, really bad headache in the back base of the head.
Okay.
Any suggestions?
Well, I would suggest to call them sparkles. It sounds almost like a migraine in a sense, and migraines are different for people in different ways. I've heard patients describe getting lightning bolts across their eyes, basically, or in an eye. They'll, and it kind of some what you're describing here. And that can be, and as far as light concern, a lot of people with migraines can have what's called photophobia, where to be in a lit room with a migraine for them is not going to happen, and they got to lay down and get and be still. With it happening in the back of the head, that at times it makes me want to think about too. I mentioned here before, let's consider it's melatonin. We mentioned today magnesium, riboflavin. Considering food allergies, but also if this person has had any injuries or whiplash, that may need to be addressed because that could still be a lingering factor. And certainly musculoskeletal pain in the back of the head can increase the chances of getting the migraines too at times. I can't quite explain how. I've just seen it in patients. So, if he or she has something like that going on or has had those sort of problems, having that worked on in a variety of ways. I'm a big one for suggesting people to see a rolfer, known as rolfing, ROLFING, for trauma what's in the body from accidents or a variety of things. Even slipping on the ice and hitting your head could start those things going for you as well.
Okay.
But, a big one for headache, a real simple one for headaches, and even for migraines, is the person getting enough sleep? 2, are they drinking enough water? Sometimes it really, and it may seem so simple but I've seen migraines not go away, but I've seen migraines improve in a lot of patients by somebody having to drink more water. They're more hydrated.
Okay.
It can be very, very helpful. So, but again, as I've mentioned, migraines can be caused from a variety of factors, and it's worth, investigating those and see what might be helpful. And, if they're not sleeping well at night, then they might want to consider taking melatonin. This study was quite impressive, and I've never used melatonin for migraine prevention, but I'm going to consider it in the future for patients for sure.
Now, you've talked about when to use it if you're sleeping nights, but he sleeps days, works all night. So,
well, it still wouldn't hurt to do it in the day. You could try melatonin because if they're working nights, then they're not going to have adequate secretion of melatonin in the first place.
Okay.
Because light is something that actually suppresses the secretion of melatonin. And we've even seen it in there's studies done on people who are blind, who can't see, and they do have higher rates of melatonin secretion throughout the days because they don't have any light affecting how it's being secreted because their eyes can't register light, and those that are completely blind. So it wouldn't hurt to take it in the daytime. It certainly could be done, to see if it would help.
All right. Thank you very much.
Okay, thanks for the call. Yeah, so folks, again, back with migraines and to get on the belabor the point on food allergies is definitely worth considering and doing elimination and challenge. Those of you who don't hear the show often, I'm not a huge fan of food allergy testing. Certainly, the standard testing, and can be patch testing or skin testing for food allergies, is only looking for what somebody might have an immediate reaction to versus a delayed reaction to an allergen. And this is where things kind of fall through the cracks with assessment for food allergies, because a lot of patients will have this immediate reaction, which is IgE, immunoglobulin E testing for foods. It could be topic based on the blood as well. And they can also get IgG, immunoglobulin G, allergy food testing that can be done. But a lot of times it does not really help out the patient because it can be highly inaccurate. That's the problem. the gold standard for testing for food allergies, I would say in about any condition, is going to be an elimination period of time with a challenge period of time. So elimination means they eliminate the allergen or possible allergens for a period of a few weeks. First of all, if symptoms improve, then you know there's some type of food-related problem going on there. And then there's a challenge period. So, for example, somebody avoided gluten for 3 weeks and then decided to challenge it. They would then have a day they challenge the gluten. They're going to eat some pasta, maybe have some bread, and then you're not going to have gluten at all for the next 3 to 4 days to see if they have delayed response that might come up. Maybe it could be a migraine for them, or it could be joint pain, or it could be a sinus problem, or just they don't feel right. These symptoms can take time to manifest in a patient, so it's important to consider that. I want to. We've got a few minutes here for the end of the break here. We got about 2 minutes and going to the bottom of the hour break here, but I also quickly, 3 minutes, perfect. Talk about gluten because it just kind of triggered something in my mind. I had a patient in recently, and I don't know who they had seen. It doesn't really matter, but the point is I saw a provider, and they basically said, all that gluten thing's a fad, being gluten-free. And it really isn't. It's something that I will tell you as time has gone on, I've been practicing medicine since 2002, so my 11th year. I'm seeing a lot more of it. And, I think that the reason, and one, it's a fad because you have more people talking about it. More people have a problem with it, is what we're seeing. And what it comes down to, too, is realizing the actual kind of wheat that, we use in this country in the first place versus where other countries might use. How come there isn't a gluten problem in the whole planet? Well, there's not. It's about a certain type of wheat we're using, and we've hybridized it through, not so much through genetics, but through, basically through horticulture to create, bushels of wheat that grow certain heights and, give us certain amounts. It's not a question of making nutritional wheat. It's about making money, unfortunately. And there are many people developing more problems with the type of wheat that we actually grow in this country than people who are, using different types of wheat products overall as far as gluten is concerned. And yeah, a lot of people consume gluten. But I definitely don't believe it's a fad whatsoever. I myself have found out a mild allergy with it. I don't eat it every day. And last year, almost a year ago now, when I went gluten-free, I lost like 10 pounds over like 2 months. And I wasn't even trying to lose weight. My weight was appropriate where it was at, I thought. And I can't really say, where that weight loss came from, and the fact that I had a colleague suggest it was inflammation. That's why it changed. But who knows? But the reality is, I can eat it here and there, and that's fine. But in every single day occurrence, I try not to. But definitely, consider, allergy testing yourself with elimination and challenge. This can be done with dairy products. This can be done with soy. You name it. So check it out. Food allergy elimination and challenge. All right, that is a sign that we're going to our bottom of the hour break. We're back here in a few minutes. Hang on there.
Running up and down the stairs. Well, it seems to me that you have said too much in too few years. And though you try, you just can't hide your eyes are edged with tears. You better stop, look around. Here he comes, here he comes, here he
Hi there, folks. This is Dr. Ellenburg, back at part 2 of our medical show here on News Talk 1020 AM, 95.5 FM. You can find us online at foxnewskon.com. You got questions about your health today? Here's the place to call. Call us at 522-1020, 522-1020. All right, well, let's move on. Typically, per show, we tend to have some type of discussion concerning cancer. Not always, but more times than not. And the main reason being, well, a couple of reasons. One, unfortunately, we're seeing more cancer today than we have in the past. And two, cancer pages, I think it's worth discussing these kind of topics. This article appeared this month's Journal of Nutrition and Cancer, an international journal. That's what it's called. And the title of the article was Online Nutritional Advice for Cancer Patients is Scattershot. Well, I would probably say the same for nutritional advice in general from providers on what to do when you have cancer. And what the team did for this study is they reviewed the websites of all of the 21 of the National Comprehensive Cancer Network Now, I've never even heard of these websites, but I guess there's a bunch of them. And they found that only about 4 of them provided nutritional guidelines for patients during treatment. And they also found out that basically about only 9 out of 21 centers provided either specific information or links to sites that do that. So again, a lack of what to do. And one of the biggest problems they saw, and that's part I would want to focus on with this article, is conflicting suggestions as far as diet. They said half the sites recommended a low-fat diet, the other half recommended a calorie-dense diet, and which leads to the fact that high-fat foods. And so the reason the study even got done in the first place was conflicting information that's out there. I mean, you have one website suggesting that people, eat caloric restriction, which I actually agree with. I mean, it's restricting calories and avoiding foods like, broccoli or cabbage or cauliflower or Brussels sprouts, which are the kind of foods that a patient with cancer should be eating, in my opinion at least. And so, better resources is really the clear guideline on this. And one part of the study that I find quite surprising is that they say it here is that in some cancer patients say there is emerging evidence that high blood sugar correlates with disease progression and poorer responders to chemotherapy and disease recurrence, meaning that if you have high blood sugar, you increase risk of cancer getting worse, poor response to chemotherapy, and having it reoccur in those who have gone into remission. Now, we do know what tumors eat. Okay, let's be very clear about that. The metabolism of a tumor is fairly well known at the moment as far as what their main fuel source is, and that's sugar. That is glucose. And I don't quite understand why a lot of these sites haven't got it figured out yet, but the number one thing at the top of the list needs to be you have to eat a low-sugar diet. First of all, because you don't want to be giving the tumors the fuel they need to keep growing, right? Now, it's not just, okay, we're also talking about things, if people eat a lot of carbohydrates. So, for instance, if you had cancer, you wouldn't want to be eating a whole bunch of pasta, a whole bunch of bread products, a bunch of high carbohydrate type food. Now, there are carbohydrates in vegetables, but not the type of, and the term to understand here is refined carbohydrates versus complex carbohydrates. And complex carbohydrates, things are not as broken down as fast and quickly. And these are the sort of things found in a lot of vegetables, okay? Or refined carbohydrates, things that make up pasta products, for example, and bread products. These are usually refined grains being used or enriched flour. I mean, unless you're making your own bread, we could have a different discussion in that direction. They do note in here that as far as making suggestions outside of, they don't say much about the whole sugar thing at all, which is I found the bad part with the article, is that depending where somebody's at, what type of cancer they actually have, it may be a difference of being on higher protein versus low protein if they can't get a whole lot of food in. And in some cancer patients, they can develop cachexia, which could require them, losing a lot of weight and muscle mass and fat. And we kind of want to keep their energy up by eating, certain types of foods. Again, sugar would not be involved in any of those groups, so I don't understand why it's never talked about. In fact, I love using the example of we know what tumors eat because there is a very mainstream imaging test that can be done called a PET scan, or positron emission tomography. And what a PET scan uses is fluorodeoxyglucose, or FDG, 18 or 20. So that's just a chemical name for it, but it's using radioactive glucose. And this is basically how the study is set up. Here's how you prepare for the study if you're a patient who has cancer. You go in the morning to have the test done, usually fasting. That means you haven't eaten for 12 hours, right? It's like doing a fasting blood draw for getting labs done, looking at glucose. And then you're given basically an IV of the radioactive glucose. And it goes around your body to areas that have high metabolic rates and areas that use a lot of glucose for their metabolism, for their energy sources, the tumors. You can light these things up on a scan and help the provider figure out, to what degree this patient is suffering, what is their staging, as well of their type of cancer, depending on where it's at in the body. So, very mainstream tests. It's been around for, 10 years. So we definitely know what tumors are eating. So I don't quite understand why we still don't give the advice, eat a low-sugar diet. That should be number one on the list of things as far as a dietary program given to a cancer patient is don't eat sugar, okay? Eat complex carbohydrates. Give them a list of foods. Here is what those complex carbohydrates are, okay, versus saying it. Frequently, I see a lot of patients come in and they'll say they've been told that they can eat what they want to eat. Don't worry about it. One guy somewhere was drinking milkshakes, and I'm like, that's just the last thing advice that should be given out to these patients is, it's time to change your diet. That's what it is. Or if you don't eat those things in the first place, I guess it's time to change your diet. For most people who get cancer, they can usually, could benefit from a dietary change, a big one in general. Now, on top of this confusing picture of what not to eat, we also get to talking about a high-protein diet versus a low-protein diet. And again, it would really, I suggest in this case, depend on where that patient is at who has cancer. Are they a low-protein diet? Won't be the best thing for them to be doing. But in those whose weight is maintaining, and sometimes you actually could stand to lose some weight when you're going through therapy in general, and are losing some weight. It's not a bad thing for some people if you need to lose some weight. But the restriction to protein is kind of the new thing taking place, because proteins in foods contain amino acids. And there are certain types of amino acids found in proteins that can support cancer metabolism in the body on how it uses glucose. And so that's a part of a new place that we're starting to work with our patients as well. And those who are open to the kind of a restrictive diet is considering the type of proteins they're actually eating and what to be avoiding as well. And there's even a bunch of current studies, one looking at specifically at caloric restriction, eating less calories, and see what kind of effect that's going to have on the cancer. In fact, there's even a study out on that right now. That's been, it's not out, but it's in the midst of taking place through Thomas Jefferson University, and that's a study where they're designed to restrict caloric intake and especially carbohydrate intake in cancer patients. And so there's a couple of these coming out, which is great. It's going to take a few years to have them published, but the reality is we're finally getting around to it. And it's great to actually hear there's a journal out there called Nutritional Cancer. I never heard of the journal. There's, of course, thousands of journals that are out there that I probably as well. But a great article, and just want to drive home the fact, again, that the basics for at least where to start with a diet if you have cancer is little to no sugar. That's the baseline to start. That's the place to start with. Now, beyond that, we can get even more detail. But that is specifically what you want to be looking at. And I don't know why a lot of these websites don't have that information on there, because it makes the most sense. Even when we have a imaging technique that's used to assess someone's status as far as their staging, for example, or where cancer might be in their body, that uses the exact same knowledge. And again, this article appeared in the Journal of Nutrition and Cancer. Another article here on cancer. One looking at exercise. And again, folks, reminders, if you have questions or comments about today's show or medical questions, we've got some, a good 15 minutes left on today's show. Give us a call here at 522-1020. It's 522-1020. And it may seem kind of like a no-brainer, but it's been a great thing to recently see. And I tend to see a lot of patients who, when they have cancer, are receiving standard therapies from their oncologists, from the radiation oncologist, be it radiation therapy or getting chemotherapy from their regular oncologist, and starting to see exercise added into the program. And what a great thing. And it's really come on strong, at least in the Anchorage area, at least among oncologists. So it's just great to see it. And we're now having, 3 or 4 studies a year coming out, looking at, hey, exercise can really make a big difference in someone's prognosis with their cancer, how they feel overall for their energy. It's an opportunity to get them in shape. A lot of people just don't exercise at all. And, getting exercise taking place in the body, it's great for the immune system. It's good for your mind. It's good for so many different things. And so looking at that as being part of the prescription for a cancer patient is extremely important. And a lot of data has come out recently from the Harvard Nurses Health Study and the Health Professionals Follow-Up Study, which is looking at about 150,000 people, doctors and nurses. And we're making some assumptions, of course, with data being collected that, they usually get a survey every couple of months. My dad was in one of this particular group, the Health Professionals Follow-Up Study he was in, and he'd get a survey every 3 or 4 months to kind of follow up, how are you doing, how's your health, what have you been eating, what's your exercise, and it's, hopefully these providers in the study and nurses tend to give correct information. We'd hope more than most. We'd hope for sure to make up for get a better idea about what things we can glean from their disease processes and what things they're doing dietarily wise over the long term. And one thing that came out of the study, part of the group was out of 150,000 people over this period of time, 900 patients developed colon cancer, and they found out there was certain types of colon cancer that was actually related to the fact to a person's metabolism, were they exercising, were they eating, and that played a factor, they believe, in their disposition in getting actually cancer. That's fairly, the guy uses here in this term, mechanistic study, but there was that part of it. And then this part I really liked was that walking improves outcomes. And in this study, which appeared in the Journal of Clinical Oncology in January, looked at basically 2,300 people. They all had colorectal cancer or colon cancer, and they measured how much exercise they got before and after their diagnosis. And the study is that those people who were a lot more physically active before the study and after diagnosis of colon cancer had a much better outcome overall. So either they're exercising before they got diagnosed, or after they got diagnosed, they start exercising quite a bit. And it wasn't like it was a whole huge amount of exercise, and specifically in this one, about 150 minutes a week of physical activity. In this case, basically walking, making a big difference in patients and their prognosis with their cancer or beating it. And the more the better. Now, I know it was just in colon cancer patients, but we need to really expand that and say for all patients with cancer. If you can exercise, obviously you can get diagnosed with cancer and be in a place where it's kind of hard to exercise because low energy, you have pain, those problems can get involved. But definitely if those aren't issues for anybody or yourself, then definitely getting out there and moving and exercise, at least walking, is a great place to begin with. And not waiting for the sun to come out. I mean, people can go into a mall and walk around for 4 hours or whatever, or 2 hours or 1 hour a day and not have to go buy anything. Just walking around. There's indoor places to walk in Anchorage, for example. I hear it a lot. Say, well, there's no snow on the ground. Well, go to a mall and walk around. Okay? Make it your exercise. And there's mall walkers all over the place. Just go there at 10 o'clock in the morning. There's bunches of people doing that. So it can be done, and it's free, which is a good thing. But the big reminder here, again, is looking at, some cornerstones to someone's cancer treatment need to be, as always, diet and exercise. And then after that, looking at things, what can be done for the patient's immune system? What other therapies can be involved? But really giving them a good place to start with, what are you eating? And do you exercise? And if you're eating a poor diet and an exercise and dying with cancer, start doing something. Don't just count on the oncologist getting rid of your cancer for you. You got to get involved in the process. You have way better results, and you're going to feel better. Okay, that's just been seen over and over again in these studies. They can't be argued with. Okay, so there's my piece today on cancer. Again, we have about 10 minutes left in today's show. If you got questions or comments about your health, our number here is 522-1020. That's 522-1020. Again, you can find us online at foxnewskon.com. And, of course, this is News Talk 1020 AM. Also find us on FM at 95.5. Well, an area concerning your gastrointestinal tract that we haven't discussed a whole lot here on the show is a category known as prebiotics, meaning prebiotics are basically the food that can help the bacteria that already exist in your GI tract grow and live better. And a study was done specifically in children, which brings up a lot of interesting findings. And this came from the Cochrane database of systematic reviews published online here, a couple of them. But they looked at adding prebiotics to infant formulas or to breast milk. In this case, the child would receive, this along with breast milk at the same time, and noticed that there was a decrease in children who developed a skin condition known as eczema, which can be common in a lot of children. And there were 4 studies that got put together in this big group, so it's kind of a meta-analysis, so to speak, looking at allergy outcomes in children aged 4 months to 2 years. And some of the numbers were quite interesting here. So up to 8% of the young children in this 1,400 infants developed food allergies, up to 20% developed eczema, and up to 34% developed asthma. Now, the study was done in Australia. So in a major city, so not too far different from us in a sense. And what I find so surprising is just the amount of children with diagnosed with asthma. It's just a huge number. A third of the children in studies developed asthma. And asthma can be in huge relations to what kind of bacteria you actually have in your gastrointestinal tract. And we have, a few studies, actually several studies now over the last 6 or 7 years that demonstrate that in women who have a history of asthma and then take probiotics while pregnant, and the children, once they're born, the infants are given probiotics, there can be a major decrease in food allergies in those children, in asthma, and also eczema and type, or even psoriasis for that matter in some of these children. So it can really be a big deal. And the prebiotics is eating things, there's a group of, for a long time, been called FOS, or fructooligosaccharides, or FOS, which can be added to a lot of formulas. But when you get bacteria inside, say food in this case, or yogurts, is typically being added to those formulas or for yogurts. So that's the probiotic, and you're trying to kind of give some similar bacteria that are present, hopefully, in that child or in that adult, for that matter, or teenager, and kind of support that. With the prebiotics, you can go about that direction as well, as taking things like chicory root's been a good prebiotic. I said FOS has been a good prebiotic. So, glutamine can be a very good prebiotic because it's actually helping out the environment in there, can help the body maintain a healthy population of this bacteria by taking prebiotics versus probiotics, or doing some of each, prebiotic and a probiotic. And you get a chance, you can type in prebiotic online. You'll see a whole host of things that can fall in that category. As far as foods, the list was too long here to put on this particular section, but it's worth looking into. So prebiotics for children, guarding against, and it's not only eczema in this case, but also other allergies, I'd say, in children as well, along with probiotics. What a great idea. Okay, let's finish up our last, let me get two in here. We'll see how we get to. I've got a little story here on nitric oxide. And again, questions about your health. Number here is 522-1020. We're going to run out of time here shortly, so if you have questions today, now's the time to call, 522-1020. But we spent some time, not for a while, talking about something our bodies make every day called nitric oxide, Nitric oxide, O-X-I-D, nitric oxide. And a lot of work came out in medical research in the mid-90s as we found out more about what nitric oxide is involved in. And even some researchers call it the signal kind of begins things and gets them going. And one thing we've known for a long time with nitric oxide is that it has an effect on the ability for our vessels in our body to dilate. That means open up. So, nitroglycerin pills have been used for years because they provide an immediate burst of nitric oxide formation for a patient and can open those arteries up and take care of that chest pain they might be having. However, we can also, our body makes nitric oxide every single day. We don't really store it. We more, in a sense, store the precursors or things needed to actually make nitric oxide. And one area that we're starting to see, again, some interesting research, and again, because it happened that we've seen so much more of it, is type 2 diabetes, or people who have what's called metabolic syndrome, which kind of can be your precursor to having officially type 2 diabetes, which kind of is a group that has several risk factors in it that include increased blood pressure, insulin resistance, meaning your body is not sensing insulin like it should, weight gain around the waist, higher cholesterol levels. All these things, of course, could increase your risk of heart disease, stroke, and further push you along the direction of getting diabetes. Well, of course, you can make changes with this as well. And one area here is looking at being involved with circulation. We know that nitric oxide is also involved in actually managing better insulin levels in our body. And there's been some studies coming out on this direct role, and even looking at how nitric oxide has a major role in how we metabolize carbohydrates in our body, which, of course, is going to affect how it eventually turns into sugar. And we're now suggesting that actually for type 2 diabetes that we really should be looking at patients also their nitric oxide levels. And there are companies coming out with products these days. What are some natural ways of enhancing your nitric oxide levels? Well, for one, is looking at what foods can do that. And for example, beetroot powder, kind of expensive to buy, but eating beets can enhance your ability to make nitric oxide in your body. And not only is it used for your vessels, it's used in your brain, it's used part of your immune system. Now we know it has some connections with how your body metabolizes glucose, in this case sugar. Supplements that can increase nitric oxide, B12, CoQ10, an amino acid called arginine, how you want to say it. It's kind of really the big ones there to consider. And there's even a company called Neogenis 40, Neogenis 40, that puts several of those things together actually in a product that people can take. We have used some of that in our patients as well with some interesting results. But again, you can get it from your foods as well, and you can certainly look up online. There's a few places putting up actually dietary advice on how to increase your levels of nitric oxide in your diet and get some benefits from that. And I'm sure we'll be seeing more and more companies actually making supplements along the way as the research continues on this novel little protein in our body, gas protein in a sense, and nitric oxide involvement in so many different parts of our body. And you can actually measure it. The same company now making Neogenis 40, the Neogenis 40, Neogenis 40. They also have salivary test strips that you can test your saliva and get an idea on a day-to-day basis how much nitric oxide you're actually making. And many of us aren't making a whole lot because we're not consuming the foods to actually make it. We could also say, like what we know, is that maybe some of us have harder means of making it versus others. I'm sure that is the case. But consider that again, nitric oxide levels, in this case being used for type 2 diabetes or a metabolic syndrome, kind of a pre-type 2 diabetes condition. Well, we have about a minute and a half. Okay. Well, I'll make this one short. Article appeared in Journal of Stroke and looked at a study involving 82,000 Japanese adults aged 45 to 65 years who had no cardiovascular disease or cancer at baseline and were followed for 13 years. And they were looking at their consumption of green tea and coffee consumption. And what they found out is quite interesting, is that those who consumed approximately 1 cup of coffee a day had decreased risk of developing a stroke. However, it doesn't mean you should drink 7 cups of coffee a day. But 1 cup of coffee a day in this case was safe. 2 cups of green tea was at the same level of success as coffee. So, getting back to what to do here, I would suggest using green tea versus coffee. But for those of you who drink a little bit of coffee, not a lot of coffee, there's benefit. And too much coffee can cause high blood pressure. So don't forget that either. All right, folks, this is obviously a sign we need to wrap things up here. Thanks for listening today. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Have a great week. Talk next Monday.
Gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No milk.